Hello, and welcome to Telemedicine 101, the ins and outs of what to expect as a patient with Karen and Jody. Throughout this video, we will be talking about the tips and tricks as you begin on this journey of telemedicine. Follow along and feel free to pause the video as needed, and let's roll. We want to provide you with the best care possible, and here's some ways that you can help. First, you're going to want to check your camera and your microphone. This will allow for a better quality for the clinician to hear you, and it will provide clear communication between you and the clinician. It is also important to note that if you cannot hear or see the clinician, that you should say something so that they can fix the issue and provide a better experience for you.
Second, find a good space for discussing your medical needs.
Make sure you find a spot that is private, but a room that's large enough if you would like anybody else to be present with you during your evaluation. If you are a minor, we'd like to help you too, but it's really important that your legal guardians are in the room with you during your evaluation.
The spot you choose should be distraction-free and large enough for you to move around, if the clinician were to ask you to.
Make sure to wear clothes that are appropriate for the evaluation needs you are seeking. For example, if you have an injury that's in the upper half of your body, you might want to wear a t-shirt or a tank top so that the clinician is able to see that area. If you are having a lower body injury, you would want to wear shorts or loose-fitting clothing so that you would be able to pull up pant legs in order to expose whatever area you'd like to discuss.
Now that we've got some housekeeping items out of the way, let's talk about the actual telemedicine encounter. First, the clinician will introduce themselves and show you the room that they're in. This will allow you the confidence that no one else is listening to your private conversation with the clinician. Then the clinician will ask for your consent to continue on with the evaluation. During the evaluation, it is important to remember that all of the information you provide the clinician is confidential between you and all of the parties involved in the telemedicine call. That will also include a detailed and thorough history, a patient care plan, as well as a diagnosis of your injury or condition.
The clinician might ask you to move around the room so that they could view your movement. They might also ask for your help in palpating the injured area, which just means to poke or push. There's a couple reasons why they'd ask you to do that. First, to get a better look at the injury site. Second, palpating can help us understand where the pain is located and what body structures might be involved. Third, moving around the body part helps us understand how well you're able to move and if there's any restrictions in your movement.
Lastly, the clinician will discuss the diagnosis and the care plan for that injury or condition. This will include your short-term and long-term goals, and it will also include the clinician discussing your home care plan and resources that you're able to use until your next telemedicine appointment.
After the evaluation is over, you should expect a follow-up email from your clinician. This email could contain referrals, home exercise programs, or just a simple reach out to see if you have any further questions. You'll also have access to your own clinic notes that the clinician took during your evaluation that day. Make sure that in that email, your next appointment time or referral date is included, as well as any contact information that you might need. We've covered a lot of information in this video, so please feel free to review it again as your telemedicine visit comes closer. Even though we are far apart, know that we are here because we care. Stay healthy.